Hi, everyone. Thank you for joining us. I'm Katie Sacra, Director of Family Programs for the GFPD, and I'll be your host for today's GFPD webinar, Symptom Prevalence and Management for Peroxisomal Disorders. We will be answering questions at the end, but please go ahead, submit your questions at any time during the webinar. You can do this in the box located beneath the webinar player window, or we'll be monitoring the chat box as well. We are grateful to have two presenters, Dr. Bose and Dr. Wangler, here with us today to talk about symptom prevalence and management for this rare diagnosis. Our first speaker today is Dr. Bose. Dr. Mousumi Bose is the Associate Professor in the Department of Nutrition and Food Studies at Montclair State University. She is the mother of Alon Betzer, who was born and died from a severe form of PBD-ZSD. Through her experience with her son, Dr. Bose joined the GFPD as the Medical and Scientific Research Liaison in 2012. Her work with the GFPD has resulted in the first GFPD research grant cycle, as well as the first treatment guidelines for PBD-ZSD, which is shown to be an invaluable resource for families affected by PBD-ZSD. Her long-term goal is to conduct patient and family-centered research in rare metabolic diseases, such as PBD-ZSD. Dr. Bose is passionate about continuing to learn about PBD-ZSD and other rare diseases, and helping other rare disease families by using her knowledge and experience. Dr. Bose, thank you again for being here with us today, and I'm going to turn it over to you.
Thanks, Katie, and thank you for inviting me to present today. So I'm going to talk a little bit about a study that I did a couple of years ago, and then let that sort of segue into Dr. Wangler describing a little bit about how to treat some of the symptoms that I will be describing. So we'll start off with this, just a very broad intro, and I know that this is probably information that all of you guys in the audience probably know, but as an intro, when we're talking about peroxisomal disorders, we know that there are many different types of peroxisomal disorders, and within these different types, there's a lot of different varying degrees of severity. One of the sort of big things that we know that sort of covers all of these disorders is peroxisomes are found in every single cell of the body, and as a result, they affect nearly every single organ system in the body. And we know that the symptoms that happen in peroxisomal disorders, they're oftentimes very clinically heterogeneous. And I know when I reflect back on my experience with my son and trying to, when my son would present with a new symptom, one of my first questions that I would ask our doctors is, well, he started to have seizures. How often do seizures happen in patients? And whenever I would ask a question like this of my doctors, and keep in mind, this was a long time ago, I would always be met with, well, we don't really have any concrete data on that. As I got more involved with the GFPD and I learned of the natural history study, I was really excited to learn about what the natural history study was finding in the sort of understanding of the symptoms and how often they were occurring in these disorders. At the time, many years ago, when I was first starting to do my research, a lot of that natural history study data had not been published. So there was still a lot of unknowns, at least in terms of what was sort of out there in scientific literature about these diseases. So as I was starting to do my research, I started to look at what were the sort of clinical studies that looked at the symptoms. And Katie, if you don't mind going to the next slide. And this is not a comprehensive list of some of these studies, but this is, just a little bit of a timeline of some of the studies that were done that were characterizing the symptoms in peroxisomal disorders over the last 20, 30 years. And what we found overall is that there were, a lot of these studies were very small. They were primarily clinician-led, which is good, and I think, a lot of these studies were run by clinicians that had a decent amount of expertise in the disease. One of the things that I felt like was missing is the sort of understanding of what the caregivers were observing in terms of symptoms. I remember always going to a lot of conferences and hearing about these symptoms that were never published in the literature that parents were talking about. And it started to get me thinking a little bit about how the caregiver, like myself, can play a role in contributing to this body of knowledge of like what the disease looked like in terms of symptoms. And if you could go to the next slide, Katie, the bottom line as I was doing my sort of literature review and starting to get into my own research studies is that there were very few clinical studies that looked at, and they were very small, that looked at like what was the symptom prevalence of ZSD as well as peroxisomal disorders. And when when I was getting into trying to figure out what type of research I wanted to do, I had access to a lot of families, and B, a very large survey platform in which I could ask any questions I wanted of my families related to these disorders. So I sort of used the knowledge that caregivers had to develop this study on prevalence of symptoms in ZSD and related disorders. If you can go to the next slide, please. So the purpose of my study, and this is a very simple, straightforward study, was really just to develop a survey tool where I asked families, does your child have seizures? Does your child have this symptom? Going through basically a battery of questions about whether or not their child had specific symptoms that we knew that were associated with ZSD as well as other peroxisomal disorders. We called this the ZSD symptom inventory. So we had families enroll in the study and take this survey. A sort of secondary goal of this study was also to look, I'm really interested in quality of life of patients as well as caregivers. So one of the things I was able to do with this huge survey platform was also upload any sort of validated surveys that looked at quality of life. And I found a quality of life survey that was measuring parental stress in individuals, in parents of children with debilitating disorders. And so we looked at what was the level of parental stress related to this disorder as well. So if you could go to the next slide. The symptom inventory, the survey where we asked about symptoms, the goal was to try to create as comprehensive as a survey that also was balanced with, not overburdening caregivers, because I know that from personal experience that we are all very busy and we have a lot of things to do. So we didn't want to barrage people with hundreds of different questions, but tried to be very thorough in asking types of questions related to diagnosis, related to different organ systems, and the symptoms related to it. For example, we asked questions about mobility, communication, endocrine function, neurology and seizures, psychosocial symptoms, the GI system, as well as other various symptoms as well. So again, pretty comprehensive. I think it ended up being something like 45 questions. So that was what the symptom inventory was about. And when we recruited for the study, we ended up getting about 92 caregivers that participated in the study. We recruited parents and caregivers of both individuals with peroxisomal disorders that were both living as well as bereaved families where parents had children that had passed away, but they were reflecting on the symptoms that their child had during the course of their life. The majority of the people that participated in the study, they identified as having their child as having a diagnosis of Zellweger spectrum disorder. One of the first questions that we asked was asking parents about what their perception of what the severity of their child's disorder was. And we given these sort of categories that range from mild to severe forms of the disorder. And when parents were asked what their perceived severity of their child's disease was, we found that the severity kind of where we had mostly living families ascribing their child's severity to be either mild or mild to intermediate, and families of individuals that were deceased, they were more likely to ascribe their child's severity to be more severe. So we kind of use this as kind of a loose designation of what we found, what the symptom prevalence in severe based on the number of families that reported in the deceased category, and mild to be more what we found, the symptoms we found in mild characterization of the disease, more in the parents that had children that were living. So we use that to kind of look at differences between the living and the deceased to give us an indication, a little bit of an indication of what was happening in more severe families versus what was happening in the more milder to intermediate. So I'm not going to go through every single detail here, but I'm happy if anybody has any questions to go over any details. But some of the things that I'll highlight here. So if you look at any of the bolded numbers here, those are showing significant differences between the living and the deceased. So this may be an indication of what's happening between, more severe cases versus more mild cases. We found higher prevalence of gastroesophageal reflux in the patients that were deceased, and we found a lower prevalence of dental abnormalities in the patients that were deceased compared to those that were living. One thing that I thought was extremely interesting and had to do with adrenal insufficiency. And even though there's no significant differences between the living and the deceased population here in the study, what we found here is that almost 50% of the families, regardless of whether they were reporting on their living or their deceased children with peroxisomal disorders, reported that their child had adrenal insufficiency. If you look back at the data that was previously published, you'll find that what was published before is that about a quarter of the patients with peroxisomal disorders in previous studies had adrenal insufficiency. So this is suggestive of the fact that perhaps that adrenal insufficiency may have been previously underreported. And we found this in a couple other symptoms as well, which I'll show you. If you want to go to the next slide. This is also looking at families that reported on abnormal EEGs or MRIs, as well as feeding difficulties and some other symptoms. And again, the bold sort of indicates differences between the caregivers that reported on their living children versus caregivers that reported on their deceased children. And you see an increased prevalence of abnormal EEG, abnormal MRI, as well as feeding symptoms and chronic respiratory symptoms in the families that were reporting on their deceased children with peroxisomal disorders versus those that were reporting on their living children. Next slide, please. So again, the bold indicates differences between the living and the deceased populations. Another thing that I want to highlight here is regarding seizures. And Katie, if you don't mind tap in the bar, there you go. Previously in clinical studies that have reported on peroxisomal disorders, what we've seen is these prevalence of, and these are smaller studies, the prevalence of seizures have been somewhere around, once again, in the 25% of all patients. And we're seeing that it's, at least in this study, as reported by parents, it's a lot more common than what we think it is. Another thing that we found that has not been previously reported was the occurrence of sleep disturbances in patients. So that's something that we need to sort of explore further. So in addition to looking at these individual symptoms, can you go to the next slide, please? We also looked at whether or not some of these symptoms were related to one another. So we looked at for example, in this case, we looked at the individuals that had seizures versus individuals who had no seizures as reported by their parents. And we looked at how often individuals with seizures compared to individuals with no seizures reported that they had adrenal insufficiency. And you'll see that individuals with seizures had, they were more likely to have adrenal insufficiency compared to those that did not have seizures. Similarly, we compared, go to the next slide, please, looked at the parents' report on low tone and as well as feeding difficulties. And we found that among individuals that had feeding difficulties, every single one of them, everyone that had feeding difficulties had also, as reported by their parents, a diagnosis of low muscle tone. Okay, if you want to go to the next slide. As I mentioned before, we also looked at, we asked parents about their level of stress through this validated survey. And overall, even though this is not necessarily reported here, we found that the levels of stress as reported by this survey were actually higher than any other previous reports on any other disease. So overall, what we got was that the level of parenting stress in peroxisomal disorders is generally pretty high, but I think we all know this. And the other thing that we found was that with respect to certain symptoms, when sort of categorizing both emotional distress and stress associated with the amount of medical care that parents have to do, adrenal insufficiency tended to result in increased parental stress compared to individuals that reported that their child did not have adrenal insufficiency. And I think we found the same thing with feeding difficulties as well in the next slide. So we saw that individuals that reported that their children had feeding difficulties also reported higher parental stress. Now, this may be, not anything that's, groundbreaking for all of us as parents. We know that a lot of these symptoms cause a great deal of stress. The other thing that I want to sort of highlight here is that as we're sort of moving towards this patient-focused drug development initiative, where we're trying to identify symptoms that we as parents want to prioritize as potential outcome points in these clinical trials, understanding which are the symptoms that cause us more stress may be something to take into consideration as we're sort of prioritizing the design of these clinical trials and what symptoms should be accounted for. So that's something additional that I'll throw in there. So I think that's all the data slides that I have. Bottom line, so this study was done a couple of years ago. So there have been studies that have been done since then. But at the time, this was the largest population of ZSD and related peroxisomal disorders that were studied. Granted, this was based on caregiver recall, not necessarily a clinical study. So a lot of these findings will need to be sort of reinforced by more clinical studies. But this is even though we as parents know of dental symptoms, kidney stones, all of these other things that I have listed here, this is one of the first studies that have sort of taken this and reported it in a population as opposed to just these individual case studies. The other thing that I think this study also highlighted is that previous reports on seizures, on symptoms like seizures and adrenal insufficiency, even though it's already in the literature, they may be underreporting how often these are occurring based on some of the reports that we found in this study. This is also one of the first studies that really took into the insight of bereaved families. So that might give us a better understanding of like what symptoms are occurring with respect to severity. And certainly this is one of the first studies that has looked at how some of these symptoms affect the level of stress in parents. So because this study was done in 2020, I want to talk just very briefly about some other studies that have been done since then that have sort of added to the knowledge that we've gathered from this study. So since then, the folks that have been running the natural history study at McGill have published several papers primarily on sensory loss. And you could probably find these papers on the GFPD website. I worked with some of the groups, with some of the members on the McGill team in trying to come up with a way to sort of characterize severity based on symptoms. And if you go to the next slide, and this is a very busy slide, but again, I believe this paper is on the GFPD website. Bottom line, this study did a scoping review of all of the clinical studies out there and tried to designate severity based on these symptoms. But one of the things that I want to highlight here is that some of the findings that we see with respect to symptoms are actually quite similar to some of the findings that we see in the study that I just on the data that I just presented to you. So hopefully this is going to be an impetus to collect more clinical data on these symptoms that we struggle with dealing with our children with peroxisomal disorders. So that's me talking about the symptoms themselves. I'm going to hand the mic back over to Katie so that she can introduce Dr. Wangler, who's going to be talking about the treatment of these symptoms. So I want to thank you guys for your time, and I'll be happy to take questions later.
Thank you, Dr. Bose, for sharing about the symptom prevalence and really highlighting some of the important areas that these studies have brought to light. Our next speaker is Dr. Michael Wangler. He is licensed practicing physician at Texas Children's Hospital, board certified in medical genetics, and he is an expert on peroxisomal disorders, which are rare genetic disorders that showcase the significance of peroxisomal organelles in human health. And thank you for being with us today and sharing about the management of all of these many symptoms that come with this rare disease.
Thank you. So I think Mousumi gave just a really wonderful presentation that shows you the wide spectrum of symptoms. So when we are talking about peroxisomal disorders, we're thinking about them sort of in two broad categories that come down to the mechanism of the disease. So the first category we could think of as single enzyme or protein deficiency. And this is where a patient has a genetic defect that affects one enzyme within the peroxisome. And then the second category is the peroxisomal biogenesis disorder. This is where the overall function or assembly of the organelle is affected. And this is, an analogy you could consider is that if you sort of have a factory that makes different products and maybe also recycles other products, if you have certain workers that don't arrive, then that could be like a single enzyme deficiency. There could be certain parts of the factory that don't function. But in another case, if the factory was never built, then the workers sort of don't know where to go. And that's the case of a biogenesis disorder. Both can have some overlap in symptoms. For peroxisomal disorders, we further subdivide and we try to be precise about our diagnosis. So the first step in managing a patient is to, give sort of a clear diagnosis. And what you can see is that on the peroxisomal biogenesis disorder side at the top left, there's two major categories that are different disorders, but both affect how the peroxisome is built. And then there's examples of single enzyme disorders that are listed on the right in orange. And we should point out that historically, the terminology for the disorders listed in green had different names, and these names were related to similarity to other conditions. And so we really have tried to move away from those historic terms and move up to the upper left, but just being aware that those historic terms correspond to like the diagnoses that we currently give. Within the peroxisomal biogenesis disorders, Zellweger spectrum disorders, which is just one box, if we just focus in on that group of patients, we see a wide spectrum of disease. First of all, there's a number of genes that could be implicated, and we could see patients that range from very severe neonatal presentations all the way up to much milder presentations that may be prone to misdiagnosis or a lack of diagnosis in some cases. The only exception of X-linked adrenoleukodystrophy, the disorders that we're talking about have an autosomal recessive pattern of inheritance. And so these are genetic conditions, and we each inherit one copy of every gene from our dad and one copy of every gene from our mom. And in an autosomal recessive pattern, typically both the father and the mother will be carriers for the non-working gene, which is shown in blue. And so if you sort of look at random chance as what drives a recessive inheritance pattern, you can see that a quarter of the children would be unaffected and also not be a carrier. Half of the children would be unaffected but would be carriers themselves. And then a quarter of the children are carrying two copies of the non-working gene and could be affected. And this is basically to think of it as a 1 in 4 chance with each pregnancy. So you could certainly have a family that has had 2 pregnancies and 2 affected children. So the way that we are diagnosing peroxisomal disorders today is changing rapidly. So in this graphic, what we're seeing is that there's sort of 2 babies. Maybe they were born in different states, maybe born at slightly different times, but their path to diagnosis differs. In the case of the baby on the left, that baby may undergo a fairly extensive workup by neurology, genetics, other specialists, and finally sort of come to an abnormal long-chain fatty acid test in many cases, followed by sort of finding the gene at the end. Now, the baby on the right is sort of getting newborn screening in many states. And in those cases, that newborn screen is sort of the first sign that there might be a peroxisomal disorder. Another example would be infants that are getting a genetic diagnosis in the NICU for seizures, for example, from whole exome sequencing. So how we are diagnosing these conditions is changing. This just gives an example of at the mild end of the spectrum of PBD, you can have patients who appear more mildly affected. And specifically in this example, the case of sort of a retinal disorder that's documented by OCT studies that we can do to see retinal changes, as well as hearing loss, had led to an original diagnosis of a different genetic disorder, Usher syndrome, before this patient was ultimately diagnosed using sequencing. The symptoms for patients with PBD-ZSD, as well as many of the single enzyme disorders and other peroxisomal disorders, it will be based on the age of onset. And so what we're showing here is a range of symptoms such as neuronal migration disorder or leukodystrophy that would affect the brain. And you can see that those would present at different ages in patients of different severities, and those would be managed by neurology. Or at least those would see neurology definitely within their management. Whereas you can have other symptoms such as the kidneys, the respiratory system, the adrenals that has already been mentioned, and we'll discuss a little bit more, retinal and developmental. And each of those at the time that they arise might require an additional specialist to be involved to optimize the care. So in this table, we're sort of summarizing a number of specialists that, one might have involved. I think, that we definitely understand that this becomes a very overwhelming and confusing process for families, because I think what's kind of depicted in this graph that I like is that there's an accurate representation of a number of things, a number of symptoms that a patient might have, but there's also sort of so many arrows that, in my mind, represent the number of specialists and other evaluations that family might have to think about. And so it is an overwhelming process. Ultimately, multidisciplinary care is one of the keys for PBD-ZSD. And so it's just something that where we need to approach each problem with the relevant specialist. This table is taken from a treatment guidelines article that we're linking at the end of this. And this gives a series of rather concrete treatments that certainly we have had many patients and experience with many patients being on some of these treatments. I wouldn't say that all these treatments are necessarily recommended. Again, each of these is going to involve a relevant specialist to, consider. But for instance, for growth failure and poor feeding, there are specific tests like a feeding evaluation, calorie count, taking fat-soluble vitamin levels, and then supplementing with fat-soluble vitamins, omega-3 fatty acids. Some patients, nutrition requires something like a G-tube. On the neurological category, many of the patients will want a neurology consult. Evaluation by MRI would be required for seeing those features that I mentioned on the previous slide. And many patients who are having seizures might have anticonvulsants that need to be managed sort of month by month by a neurologist. And then there's hepatic dysfunction, where patients can have sort of ongoing evidence of liver injury, and cholic acid is a supplement or a medication that is the subject of publications, and we're definitely recommending that patients have a hepatologist if their labs are showing abnormal liver functions. And we can sort of continue to go from here. Sensory neural hearing loss, one could consider hearing aids, cochlear implants, Adrenal insufficiency, as Mousumi mentioned, is, I think, becoming increasingly more recognized. I think it was probably under-recognized before, and that has a very concrete treatment and management. Skeletal abnormalities have been a focus of some of the research that we've had presented at the GFPD. Patients with these disorders are prone to low bone density, and there's a very good management program for genetic disorders that affect bone density that is now being employed. And then kidney insufficiency also, again, may require a specialist. It depends on what labs are showing. This may not be an issue for many patients. Vision loss is something that we would recommend a evaluation by an ophthalmologist, sort of not just the eye exam at the pharmacy. And then developmental delay, a developmental pediatrician, a developmental consult can be invaluable, especially if patients are moving into school age. So thought we would just give a couple examples of where we have published treatment guidelines. And these published treatment guidelines were based on our work over time as a group to put down on paper, our best sort of advice that we could give that can be shared with other subspecialists who may not be familiar with PBD, as well as with families. And this is just to kind of highlight that within those treatment guidelines, there are very concrete, ideas that one can look for and sort of see what approach should we take. So for instance, for bone loss, fractures, or bone pain, we're sort of recommending a monitoring of bone density through DEXA scans, evaluating the vitamin D status, because vitamin D is something that we can fix with supplementation, and bone density loss can be due to vitamin D deficiency, or an individual could have sufficient vitamin D and still have bone loss. And so those are two very different scenarios. Physical therapy, weight-bearing physical activity, these are all things that are good for bone density. Then a second example would be the adrenal example. Patients may present with symptoms, weight loss, nausea. Also, a concern amongst clinicians would be that there are no symptoms, but that a patient could have some danger with major surgical procedures or a sudden illness. And so in this case, adrenal function tests in these disorders to screen for individuals who may have adrenal dysfunction. And then some individuals do require steroid replacement, and then what we call stress dose to avoid those problems with major stressors like surgery. And so, after a year of age, adrenal monitoring is currently our recommendation. So I think just to summarize kind of maybe both parts of the talk, peroxisomal disorders are a group of genetic diseases due to peroxisomal gene defects. And, proper diagnosis is, of course, the first step. The biogenesis disorders represent a clinical spectrum of disease that can range from early onset and very severe to later onset and more mild. And the features can be based on that severity and onset. Screening and diagnosis is changing as things like newborn screening and exome sequencing become more ubiquitous. And, atypical peroxisomal disorders can be misdiagnosed. So we're picking up patients who we have not detected before. And so the medical management of these conditions really involves multidisciplinary care and is based on the problems that can arise and looking for those issues and then treating them if appropriate.
Thank you so much for going through all of that with us and helping bring together the different publications and how it can help, know what the symptoms are, and then that there are, ways to monitor based on the symptoms, and even without the symptoms. There's things to monitor for, as well as manage and treat some of these symptoms that happen. So at this time, if you haven't already, please go ahead and submit your questions. You can do this through the chat feature, as well as there's a Q&A little box at the bottom of your screen that you can select. This will allow you also to submit anonymously. Either way, I won't share your name. So please go ahead and ask any questions that you may have, and we'll do our best to get those answered for you in the next few minutes. We do have one question that it came in, and I'm not sure if it maybe needs to be directed more to an endocrinologist, but I will share. If a child is on steroids for lung issues, how would a correct test be done for adrenal insufficiency?
I mean, I'm not an endocrinologist, but I will just say that if it's a sort of local, meaning an inhaled steroid, we wouldn't expect that to have a effect on the testing. The testing could still be done. If it is more systemic, where you're taking oral steroids, the approach would really be that, yes, we wouldn't be able to measure to know if the adrenal is at full function in that context. But then the idea would be, then we just need to treat if there are issues of where there's an illness or there's going to be a surgery, we're just going to need to give that stress dose because of that sort of chronic treatment with the systemic steroids.
Thank you. And then I do have a quick question that I thought maybe even both of you might be able to help our families mostly with this question. And that it would be, there's a lot of different publications out there, and we will make sure, just so everyone listening knows, we will make sure that we share with all of you all the publications that have been referenced. But how would you suggest families and patients even advocate for their own health or for their loved ones' health by making sure that the professionals have the correct publications in their hands? What would be the best way to get those in their hands and really advocate to know about all of these symptoms and that there are ways to manage them?
I'll start, and Dr. Wangler, if you want to give your 2 cents, that would be great too. I think honestly, and this is going to sound like very like straightforward, and there's no really utilize the GFPD as a sort of platform to get information from. Sometimes there may be publications where some of them may from the internet, you may not be able to have access to full access to some of these publications. If there's something that you want to read, the GFPD has ways to get these full text access to some of these papers. And I think the GFPD has been really good about keeping up to date with some of these publications. So just simply going to that place on the website where you can see the different research studies that have been done, and making sure that, I've talked to families that have printed out the treatment guidelines and just taken them to folded them up, put them in their back pocket, and taken them and handed them to their doctor, and say, this is what the experts that are treating this disorder are saying in terms of how to manage this disease, and really just sort of keeping on top of that, and just really making sure that when they reach out to their medical professionals, that they are aware of what experts like Dr. Wangler are doing in the field, as well as some of the other clinicians, the expert clinicians in the field as well. Did you have something that you wanted to add, Mike?
No, I agree with what you've said. I will say that I think that there's a balance for families where there may be a need for a specialist to be involved, and that specialist, in some cases, it may not really matter if they're that familiar with PBD specifically. What matters is sort of their specific area. Then in other areas, like maybe with child neurology or medical genetics, it would be better, nicer if the specialist has had some experience, or at least has knowledge of the treatment guidelines. So I think that's one thing to realize, is that there's going to be a range of familiarity with PBD-ZSD amongst the providers. But just working with the right, team of providers is kind of a process.
Thank you. I agree. I've actually been one of the parents who have taken publications with me in hand, and it's really been helpful, I think, to everyone that's on the team. We have another question very specific to the liver regarding ALT and AST. Our son's levels have recently tested higher, and this is a concern for us. Can this go back down over time? What questions should we ask his hepatologist and these numbers and what they may indicate?
Yeah, I mean, that's a good question. The key is that the ALT and the AST are markers of what you can think about is that there's a spilling out of some of the liver enzymes. So it indicates some liver injury. Liver is pretty good at just regenerating and going along, but chronic injury can be an issue. What would get more to the heart of it is looking at bile acids and bile acid intermediates, because that's more related to what we think is causing the liver injury. So I'd say that if the hepatologist is maybe could look at the treatment guidelines and just sort of do an evaluation for bile acids, because that's not always standard in just the case of an elevated AST, ALT.
Thank you. We also have another question about nutrition. Do you have any recommendations for the nutrition of strongly affected babies or kids? Maybe a low-fat diet, a special oils?
Right now, I think there's not enough data out there to make any sort of strong recommendations towards any diet or another. Certainly, if there are issues with growth and feeding, there may be a need to, say, have a G-tube placed or maybe increase calories. There may also be a need for supplement because of the bile acid abnormalities that we see in a lot of our patients. There may be a need to add fat-soluble vitamins if there is any sort of malabsorption going on of fat-soluble vitamins. So that tends to be quite common as well. I'm in the midst of analyzing data from a diet study to sort of as a sort of first step to get an idea of how to best keep track of what are the calories, what are the nutrients that our patients are getting. But until we do more research on the role of nutrition on the symptoms of the disease, it's probably going to be it's going to be a minute before we can get any sort of clear-cut, concrete nutritional recommendations other than the ones that I have mentioned here. Dr. Wangler, can you think of any other clear-cut nutrition recommendations that you give to your patients?
No, I mean, I think the way I explain it is that we'll show some slides that say what the peroxisome does, and we'll say, well, you're missing plasmalogens. But, in various contexts, supplementing with plasmalogens has been tried and doesn't have an immediate effect as far as we can tell. You can look at our slides and say, oh, there's too much phytanic acid. Phytanic acid has been tried. Some people think it's not too hard to follow maybe, but there's no direct evidence for it. So probably what's happening is that we don't quite understand exactly what is going into the diet, how that could affect the metabolism. The metabolism in these disorders is complex. So I think just sort of recommending common sense, and it's still a growing child in most cases, and we're working on it. We're trying to find sort of how the biochemistry relates.
Yeah, absolutely. And the truth of the matter is, looking at all the studies that have been done, that have been published regarding, that have sort of briefly addressed diet, at least as in sort of my sort of understanding, this in terms of keeping track of the diet, it hasn't been extremely thorough. And so there is a need to actually better track the how better track dietary intake in this particular population. And that's what I'm doing right now. And I'm like in the midst of actually writing a publication on simply just tracking. That's not going to answer all of the questions that we have regarding nutrition, but hopefully it will be a first step so that once we know how to better track diet in this particular population, and we can do that with some level of confidence, then once we have that tracking method down, then we can be like, well, what happens when you have patients that are on a low phytanic acid diet, or if they're supplementing with DHA, does that have an impact on symptoms and overall quality of life? That's hopefully going to be the next step. So I'm sorry I don't have a better answer for that, but as Dr. Wangler says, we're working on it.
Thank you. I do have one more question I think we can fit in. I think it's really important. It's about regression. And yeah, as we know, there's a lot of symptoms that we've talked about today. And sometimes you may see some individuals just have that where they stay stable for several years. And then you may see that regression happen, or you may see a slow regression over time. And it really varies with individuals that are affected with this disease. So this person wrote in about their 25-year-old son who's recently had what seems like a large regression. He has a cochlear implant, so they are unable to obtain an updated MRI without magnet removal. They did recently have a CT with and without contrast, as well as an EEG. They don't have those results just yet, but they're wondering, is there any other testing they should consider when trying to establish if there's been a white matter change, or are there any other occurrences outside of PBD, something that they're missing that they should be looking for?
So it's a tough scenario when you are not able to get that MRI because of the magnet, because the MRI is really the best way to look at the white matter. I think the question there, though, is also, can we follow along with the symptoms? Good sort of documentation of the regression with a neurologist, I think, is important. And determining, because one thing about a good neurology exam is that, it really can pinpoint. I'm talking about going to the doctor's office and the neurologist, testing reflexes and doing an exam. It really can pinpoint a lot of areas of what's going on in the brain or in the muscle. I would say working with a neurologist is like the most important aspect there.
Thank you. And Dr. Bose, did you have anything to add about the regression?
No, I will say that, to that person, that they are not alone in, what they are experiencing. And this is definitely something that, even I just ran a whole bunch of focus groups with a lot of people recently, and the regression and sort of like dealing with the regression, it has been one of the most commonly discussed topics in the focus groups that I'm dealing with. So again, I know that doesn't solve or, address the question, but, hopefully you find some sort of comfort in knowing that you're not alone. And, there may be other families here that may be able to like weigh in on some of those experiences.
Thank you so much. And we had other questions, and I really want to respect everyone's time. So please reach out to the GFPD. You can reach out to myself as well, and I will do my best to, follow up and get these answers for you. I want to thank Dr. Bose and Dr. Wangler for being with us and taking the time to share your expertise with all of us today. I'm just really grateful to have collaborated with you on this important topic. I know it's just something that weighs on our families every single day. We are always having new questions because these symptoms are just overwhelming, as many of these slides showed today. To our audience, thank you for participating. We ask that you please take a moment to complete a survey after this webinar. And please know that, again, I will make sure that all the publications that we referenced are sent out to everyone who attended. This was recorded, so we will make sure to send that as well, so that you can listen back if you need to just clarify some of the things that I know we talked about a lot of important things today. So again, thank you to our presenters. Thank you for being here. Thank you to our audience. And I hope everyone has a great rest of your day.